Hey guys, Dr. Tommy Rhee here, and today we're going to talk about that old world of having pain. What is pain? What sets it off? And what can we do to kind of control that pain? Now, let's take an example of like a swollen ankle from like a rolled ankle. You sprain your ankle from a curb. What do you have right there? Are you really dealing with the tendon or the ligament problem, or is it something else? Well, that something else is inflammation. So remember how when you like roll your ankle from like a curb and all of a sudden you're able to walk after that, but like a day or two later you have that swelling and now you can't walk on that ankle. Well, what happened between that period of you were spraining the ankle, you're able to walk, but now the next day you can't walk? Well, inflammation. Inflammation is what really sets the cascade of that thing we call pain. Pain is one of those mechanisms that gives that feedback to our body saying there's something going on. Well, think about when you have a box and then that box has things like, toys and boxes and stuff like that, right? So then you put fluid in there and then you're able to close that box. Now you put more fluid in there, inflammation. Now that box has that point where you can't close it. But if you force that box to close, it's pushing on the pressure. Well, that pressure you're pushing out hits these sensory neurons called our pain receptors, and that's why we get pain. So the secret is you have to get the inflammation out. You have to find a way to get that inflammatory world out. Now, there's two ways of getting it out. There's a way of nitric oxide activation. Nitric oxide, remember, it's that gas that does the vasodilation of the small vessels to open up those vessels, capillaries, and allows those fluid inflammation to flush out. The next one is a positive negative gradient. It's like that oncotic pressure, pushing, pulling, pushing, pulling. That fluctuation of fluid helps push that fluid out. Those two things are activated, awesomely enough, with power plate. Power plate will give you that advantage to activate the nitric oxide and also that pressure point of positive negative gradient. So when you have that inflammation that's due from a sprained ankle, from an acute or chronic situation, think about the fastest way to get it out there, those two mechanisms. So when I have a sprained ankle patient or a knee swelling, the first thing I want to do is assess them, make sure they're okay. And then when I get them neutralized, get them on the power plate. Power plate, you have to do more than 9 minutes. 9 minutes is a standard protocol. You set it in a low setting, a low frequency, 9 minutes minimum, 10 minutes the best. Just stand on there. That pressure going back and forth, the oncotic pressure, positive, negative gradient with the power plate, and the activation of nitric oxide will reduce the swelling. When the swelling gets reduced, your pain goes down. When the pain goes down, now you're on your way to recover faster. Remember, pain is not so much the injured tissue, it's the inflammation around that. Address that. Okay guys, if you have any more questions, give me a call.